Ladies and gentlemen, please welcome to the stage Antrell Tyson, Esquire, Regional Director, U.S. Department of Health and Human Services. Colleen McCarty, MPH, Acting Regional Administrator, Office in Intergovernmental and External Affairs, Region 4, Health Resources and Services Administration. John Guilford, Regional Health Administrator, Office of Assistant and Secretary of Health. And Darshak Singavi, MD, Program Manager, ARPA H.
Good morning, everyone. I hope you all are having a great conference. Everything good so far? Okay, give it just a minute to let people come in. Good morning. My name is Antrell Tyson, and I have the honor of serving as the Regional Director for Region 4 for the U.S. Department of Health and Human Services. I would first like to start out by thanking Health Connect South for inviting me back. This is my second year here. Last year I had the privilege of opening up this conference, and it was my first time experiencing Health Connect South and the level of conversation that was being had about connectivity, collaboration, innovation in the healthcare space. And fortunately for me, that is my job. My job is to engage stakeholders across the region to help them connect better with the federal government and for us to learn more about the things that you're doing. So I followed back up with Russ and said, we need to be here. We need to, as a federal government, and we need to be able to talk about the things that we're doing, because I feel like sometimes we operate in silos where we're working with the stakeholders that we already know, that we're already comfortable with, but then we don't do as great of a job of widening our net and inviting more people in to help us with the things that we're working on, and vice versa, because I know I get the chance to meet a lot of you all and talk about the work that you're doing. And the best part of my job is connecting you with resources inside of HHS to help you in the work that you're doing as well. So with that being said, without further ado, I will go ahead and introduce our panel, who lead a lot of the initiatives that we're going to talk about today, and are the heads of the operating divisions here in Atlanta and also in DC, who are leading a lot of the work that we're doing around innovation and collaboration. So first, I'd like to introduce Dr. John Guilford, who's the Regional Health Administrator in the Office of the Assistant Secretary of Health for Region 4. We have Colleen McCarthy, who's the Acting Regional Administrator for the Health Resources Service Administration, which many of you know as HRSA. And then we have Dr. Darshak, Dr. Segavi, the Program Director for the Advanced Research Project Agency for Health, which is ARPA H. So, as you probably know, that we have, not like Dr. Toon, we have some money in this room, so hopefully we'll have a little more interesting conversation about how you can connect with the services that we are offering here at HHS. So I'd like to start with you, Dr. Guilford. So just introduce yourself, talk about your role as Regional Health Administrator, and some of the initiatives that you all are working on.
Great. Okay, everyone can hear me fine. So. Again, my name is John Guilford. I'm the Regional Health Administrator for HHS within the Office of the Assistant Secretary for Health. So HHS has 10 different regional offices. Each has a Regional Health Administrator, pretty much serves as the primary federal or senior federal public health official for that particular region. I have the honor of serving as the Regional Health Administrator for Region 4, which is the largest and, in my opinion, the best of the 10 regions. My office is located right here in downtown Atlanta at the Sam Nunn Federal Center. So unlike many of the operational divisions that you're probably familiar with, CDC, HRSA, ACF, SAMHSA, OAS, the Office of the Assistant Secretary for Health, is a staff division. So it sits directly in the Office of the Secretary, also with the Office of Civil Rights, administration, finance, all of those offices providing leadership, guidance, technical support. And within OASH, there are 10, maybe a dozen now, they're adding, key public health offices. I won't go through all, but some of them include the Office of Minority Health, Office of Women's Health, Office of Disease Prevention and Health Promotion, which is responsible for many are sure familiar with Healthy People 2030. Office of Infectious Disease, HIV/AIDS Policy, which oversees the ending the HIV epidemic. Also, the Office of the Surgeon General sits within OASH, the Office of Long COVID, and several different offices, and of course, the Office of Regional Health Operations. And my office primarily serves as the representative for the ASH. Our current Assistant Secretary for Health now is Admiral Rachel L. Levine. And we serve as the representative for the ASH in the region. And so we're really that connective tissue that gives the folks, our stakeholders in the region, state level. I work a great deal with Dr. Toomey and other state health officers within the region, our local health departments, community-based organizations, faith-based organizations, and private for-profit institutions as well, to make sure that they know how to navigate the broad federal system and all of the different federal services that are available from a public health sense, but also to make sure that there's a voice, that their voice is heard at the federal level, and so that their specific needs and priorities are able to be addressed and incorporated into the plans and guidance that's done at the federal level.
Great, thank you for that. And Colleen?
Yeah, good morning, everyone. Again, I'm Colleen McCarty, and I currently serve as the Acting Regional Administrator for HRSA's Office of Intergovernmental and External Affairs. So similar to Dr. Guilford, we're regionally based. We cover the 8 southeastern states and 6 federally recognized tribes. And our role is really, we also kind of serve as the representative in the region for the HRSA administrator. So we amplify our priorities, which are maternal health, behavioral health, substance use disorder, and workforce development. But we also serve as a convener. So we have public health analysts on the ground that are constantly doing surveillance across our states and really trying to connect the dots. So that we can, as in the example from the previous panelist, there was the home visiting program in New York City, but there was also a home visiting program being grown in Georgia. You know, we want to be able to help make those connections and amplify best practices and, of course, not reinvent the wheel. And I also like to say that I hope folks in the room are already familiar with HRSA, but we tend to be the largest federal agency that you're probably familiar with our programs, but we just don't quite always have that name recognition. We do have kind of a PR crisis in public health. So I do want to kind of amplify our community health centers. I was recently out doing some kind of stakeholder engagement in the field, and so many folks were just unfamiliar that there are healthcare services available to them regardless of their ability to pay within their communities. And so trying to make sure that we're just, spreading information and awareness about all of the different programs that we have.
Hi, I'm Darshak Sanghavi. I'm a program manager at ARPA-H, the Advanced Research Projects Agency for Health. My background is I trained in pediatrics and pediatric cardiology. I still take care of little kids with complex cardiac defects. But my background, I spent some time in federal government. I used to be a director at the Center for Medicare and Medicaid Innovation, so I worked on helping develop some payment models to improve prevention and population health nationally. And then also spent some time in the private sector as a chief medical officer at Optum and United Healthcare, and then for a global health services company. So ARPA-H, in many ways, some of you may be familiar with, it is a new federal agency, just been around for a couple of years, funded initially with $2.5 billion and given an additional $1.5 billion, so about $4 billion under sort of its purview. And the idea is that we fund high-risk, high-reward research nationally in a way that sort of tries to meet the needs that are not necessarily being met by other sources of funding. Of course, we have incredible colleagues at CDC, NIH, HRSA, and a number of other places, ASH, but we fill that role of those higher risk, higher reward areas. We sit at the same level as those agencies. We report directly to the Secretary of Health and Human Services. I was just looking, just before coming here, just pulling, just in the greater Atlanta area, we have funded about $75 million worth of programs at Georgia Tech and Emory. That's just what's been announced. There's probably more in the pipeline right now. So we do really take a lot of pride in making sure that we serve the entire country and find innovation wherever it may be, and particularly in wonderful places like Atlanta. As a program manager, I don't know if this is the best analogy, I'll just put it out there. So you know how 007 was licensed to kill? Program managers, we have this special. We're licensed to fund, meaning
Great save.
that program manager. Yeah. It's like the only way I can make myself feel cool about having a federal bureaucratic job, I guess. But what I'm trying to say is that it's a unique model of actually finding innovation, in the sense that unlike NIH, where there are study sections and sort of a much more complex process, at ARPA-H, for example, the funding I mentioned, the way those were initially put together was those individual organizations or innovators just sent a 3-page proposal to ARPA-H. A program manager like myself, one of these sort of people who've really are entrusted by the American people to sort of help look through that, say, look, we like this idea, send us a full proposal. If they do, just the program manager and the agency director together can just make a decision to fund it. That's the process. That's what I mean. So it's an incredibly light touch approach, but they are not grants, they are contracts. So you're held to certain milestones, and you're held accountable to reach them. So I'm sure we'll have a chance to talk about some of the types of things we fund, but my portfolio ranges from completely remaking public health to something called the HEROES program. We're creating a new incentive and monetization model around maternal health, opiate use disorder, alcohol use disorder, and cardiovascular risk, to, on the other spectrum, entirely new approaches to organ donation, preservation, women's health, cell gene therapy, regenerative medicine. So my portfolio is pretty broad there.
Great, thank you for that, and we certainly will circle back to that. But I want to start the conversation here. So we're here at Health Connect South, and the one thing that we love to highlight is our ability to collaborate and engage with the community. Could each of you talk about how each of your agencies collaborate with the community and leverage the partnerships that we have in and around the region and also nationally? Either one.
Sure, I can jump in. So essentially that's what we do, and that's our role, is to engage the community and engage our stakeholders at the state level, at the local health department level. We work directly with community-based organizations, like I said earlier, private organizations, faith-based organizations, and we've done that consistently on a regular basis. A good example is coming out of COVID-19, we established a health equity council within Region 4. And that council consisted of pretty much the alphabet soup of federal partners, brought them all to the table to make sure that what we were doing was coordinated and we were doing it in a collaborative method so that it would have the highest impact and would be efficient. And so we had representatives not only from HHS, but also FEMA, Department of Transportation, USDA, you name it, everyone was at the table. At one point, we were meeting on a weekly basis, later scaled down as we started to see some progress in terms of the pandemic, scaled down to a bi-weekly basis. And what we were able to do was bring people together from all of these different agencies, and we could hear directly, because we were speaking directly to our stakeholders in the community, hear exactly what their needs were and come up with a strategy to address those needs in real time. So opposed to waiting for something to go through the regular federal process and guidelines and policies, hey, we heard from our constituents in rural Mississippi that they're having issues in terms of testing for COVID. There's issues in terms of access to therapeutics in certain areas. and or issues in terms of transportation, rural, being able to access treatment because of lack of transportation, especially in rural areas. Well, we had the regional director for the Department of Transportation as part of our meeting on a regular basis. We had the regional director from HRSA as part of our meeting, from SAMHSA as part of our meeting. And so we were able to, and from FEMA. And so, for example, for testing where they had issues, we could speak to the person from FEMA right there in real time, and they could have a mobile unit in that rural community the next week, as opposed to waiting and going through the long process. And so we found out to be really effective. And so at that time, I'm sure everyone remembers, there was this point where health equity was the cool word. And everyone you could think of had some type of health equity council, group, whatever. How many of those are still around now? We wanted to make sure that that did not happen to us. And we wanted to build upon that, on the success that we had with that, and replicate that and apply it to other issues outside of just COVID-19. So we have a maternal health collaborative that meets on a regular basis. Maternal health is a priority within our region. And same thing, we get together. One is to make sure that we're not redundant or duplicative in terms of what we're doing, but also making sure that we can strategically assess the needs and then collaboratively come up with a plan to address those specific needs within the region. And so that has been a successful model for us, and we've been trying to duplicate that. One thing that someone mentioned earlier during a previous session was that there needs to be something to ensure sustainability. Right now, a lot of that is driven by the commitment of the individuals that are part of those groups. But what happens if if someone leaves and goes to a different organization, or a person retires? We need to have things in place to ensure that that level of effectiveness and success that we achieve continues. And so now we're working to make it a more formal process, put MOUs in place, things like that, to ensure that it stays and is permanent.
And I also want to highlight another thing, and I failed to mention this in my introduction. So the difference in our role, so I'm a political. I was appointed by the president in 2022. And, you know, as politicals, they come and go. Fortunately, we have the regional health administrator, who is the career, so once we do engage on a policy issue and we create this inertia around a policy issue, a lot of times it's, you know, if it remains under the regional director's purview, it may be subject to change with the administration. However, once we, you know, by us working together, a lot of these commissions can remain permanent per administration, and you continue to have that point of contact within HHS to maintain work around those initiatives. So while our office typically serves as the front door to do engagement around the presidential and the secretary's priorities, we continue to have that constant drumbeat within the office of the Assistant Secretary of Health to maintain the momentum on issues. So I think that's a great distinction to make that I failed to make in my introduction. So thank you for that. Colleen?
Sure, yeah. Speaking to collaboration and building partnerships, that was one of the reasons why I was so attracted to coming to this office, is because there is so much opportunity out there. We last month, actually, several of us, our offices on the stage, went to the Mississippi Delta to engage with experts in the field, doctors, OBs, nurses, doulas, etc. And being able to kind of hear from the folks what's going on the ground and bring that back up to our leadership. That's really what the role of my office is being able to go out into the field, hear what the needs are, what the pain points are, and communicate that back up in a way to our leadership that, you know, you have to be able to kind of tell the story. So we're here to kind of do that. And then once we hear what the issues are, being able to collaborate either with our federal partners or community-based organizations or what have you. I think in Region 4, we have really strong leadership in this region. We work together very closely because we don't want to duplicate efforts. We want to amplify each other's work. And one of the comments that was made when we were in the Mississippi Delta last month was, the resources are here. The resources are on, we have the resources, but how do we work together effectively? Some folks were working in, telehealth, and they had no idea that there were needs in other, certain pockets of Mississippi. And just, being in the same room together, really kind of built a path forward for us when we're looking at reducing maternal morbidity and mortality. So I invite you, if you see me later today, let's chat. We definitely want to hear from the folks on the ground. We want to be able to make connections, and we want to be able to amplify and lift up the work that's making the most impact.
Yeah, so I'd say we love working with both federal agencies and with partners in the community. But I want to give a little bit of just sort of guidance about maybe how the ARPA-H operating model works, which is the thing we start with is collaboration is a terrific thing, but it should be, at least for ARPA-H, in the service of a specific problem that you're trying to solve. So I'd say the way we start is, what is the thing we're trying to accomplish? So let me give one example. So I think many organizations and communities are worried about the problem of inadequate care for mothers as they're giving birth, maternal morbidity and mortality. So the problem we're trying to solve, one of the programs I'm overseeing is called HEROES. So as we know, when you look at mothers who die, that's just the tip of the iceberg. The iceberg below the surface is severe obstetrical complications. Think about all the things that can go wrong during a delivery, right? Bleeding, sepsis, pulmonary embolism, cardiovascular arrest, a number of other challenges. And then many of those also occur postpartum, and then there's also the issues that are related to social determinants and mental health, interpersonal violence and so forth. So we actually created a measure that now tracks that. So let me say the first piece we collaborated, we said, look, how do we actually create a real-time measure at the ZIP 3 or county level nationally? That's a specific problem we're trying to solve. So we talked to our colleagues at CMS and CDC. What is the measure using? How do we customize it? We said, how do we get the data? Then we talked to our colleagues at ONC to say, well, what are some of the strategies? And then we said, well, okay, how do we actually leverage that contracting? Of all places, we actually worked with the Department of Transportation and the National Cancer Institute to leverage contracting vehicles to get that data. Within 2 months, we actually have built a national dashboard that actually tracks all of that. The next step is, how do you create an incentive model to actually make that better at scale? That's what the HEROES program does. For those of you not familiar with it, if you just Google HEROES ARPA-H, this is going to be the largest investment in an outcomes-oriented financing model, the most fundamental kind of value-based care, and we're leveraging an enormous amount of sort of partnerships to actually do that. Organizations right now are actively applying to be part of that. We'll be sort of announcing that. But we collaborated, my point is, with CMS. CMS has a whole model around transforming maternal health. That is actually going to take place in several years. We need something sooner. We need an accountability framework now and the ability to work very quickly. So we collaborate with CMS in that area. That's just one example of how we work across partnerships, but that way everybody who shows up at meetings, because everybody's got meetings and you have time, they have a job. They have a deliverable. They have a thing you're supposed to do, and you're also a framework for accountability because we measure that outcome. And most importantly, all of it's under contract. So if you don't hit your milestones, people don't get paid. And then the paid part I'll put behind it. The other thing I'm very proud of at ARPA-H is we don't just sort of ask people to convene, but as I said, we actually have like significant dollars behind those. So as I said, it's a request, but it's a request made, and if organizations get together, they're successful, then they actually get financial benefit from those as well.
Great, thank you for that. And beware after the panel, I think you're going to get bombarded when you leave here. But looking ahead, what are some emerging trends in the health innovation do you all see impacting your agency and the way that you all operate in regards to collaboration and investments and innovation. Colleen?
Sure. Well, I will say that the Biden-Harris administration has invested a lot into maternal health, workforce. I think, COVID has really burnt out our essential workers, and we really are kind of in this healthcare crisis right now. Just yesterday, HRSA announced $100 million to support expanding our workforce efforts. And so, and I think in terms of, you were talking about, R.D. Tyson, what's on the horizon and kind of changing the landscape. I mean, I think data is probably first and foremost. That was something, again, that we heard when we were in the Mississippi Delta is, our data systems don't talk to each other. Or, wouldn't it be great if we had a maternity kind of tracking system where if a mom goes to this particular health center and then goes to this hospital, you can kind of see that record. I think we're kind of moving in that direction where we're trying to integrate data systems that can speak to one another in an effective way so that we can be more data-driven in our decision-making. In addition to data, I think AI is probably, it's a little bit scary, but that is also something that I see as kind of transforming the public health landscape in the years to come.
I would say innovative, there's a number of different things you could say, but one, innovative approaches to how we work together. So approaches to further enhance collaboration and coordination and efficiency. One of the key ways that's being done is so over the past 4 years, over 47 different federal agencies, not just HHS, across government-wide, have worked together to develop People and Places Thriving. That's the federal plan for long-term resilience. And it's an operational roadmap that lays out a plan for federal agencies to work together to get the people we serve to a place of thriving and resiliency. Initially, the plan was called the Long-Term Recovery and Resilience Plan. But coming out of COVID-19, we realized that we need to do more than just recover back to where we were before COVID-19 because obviously we weren't adequately prepared. So we want to do better than that. And so it's thriving, people and places, and resiliency. And so, like I said, 47 different federal agencies have already been part of the work group. The plan is available online. If you just look up Thriving People and Places, it'll take you to it. You can look at it in full detail, but it focuses on working together and leveraging existing resources, so not developing new policy, not coming up with new funding, new resources from different agencies, but how do we best leverage those resources that we already have? And so that could be funding, but beyond just funding, that could be policy, could be guidelines, could be staffing and workforce, a lot of different things that we already have in place that if we work more collectively and more in a more coordinated fashion, that we could address these, the plan lays out as the essential core elements. And there are things, and there's 7 of them. I'm not going to try to repeat them all because I'm sure I'll forget some, but they're basic things like humane housing, having a health and safety, long-term education, behavioral health. All of these things are things that we all address anyway. And so it puts together a plan. Admiral Levine refers to it as the evolution of the social determinants of health, because instead of focusing on the issues and the problems, it puts together an active roadmap for collectively addressing that. And so I think that's one way that is innovative and looking forward to seeing how it rolls out as we move forward.
So the question is, how do we encourage innovation? Is that what?
Well, yeah. So how does emerging trends impact your agency? And I think you all are on the cutting edge of it. You are a result of trying to solve for emergent trends and being responsive. But even looking further ahead, ARPA-H, this new innovative way of addressing issues, how do you see that it's changing?
Yeah, well, let me put it this way. So let's say we want to solve some really complicated challenge in gene therapy to, say, cure sickle cell disease, or we're interested in new approaches to cancer, or how do we actually preserve and create organs for transplantation. Like, there's so many complicated problems to solve, and I think traditionally the way innovation has been funded is, you put out a call, say, hey, can you help us on this really specific topic? Or you send in a grant application, and then the people who review that application are often those that are already embedded in that work. That's a great thing, because what that means is that you benefit from expertise. Is this something which is really scientifically legitimate? One of the challenges, though, is that many people, when you look at those reviewers or the ways in which we fund it, they often may be path dependent. They'll fund things that they are familiar with, or institutions they know, or people that are like them. In other words, if we're actually going to really innovate transformatively, then we have to also have a process which is open to entirely new ideas, which we may not even know about. So at ARPA-H, we sort of have two models of funding. The first start, we can come up with programs. So I mentioned the HEROES program, which is to radically remake how we fund prevention and outcomes to address health equity nationally. That's a program that my team has created because we had a vision. But the concordant approach is what's called the ISO, or what formerly was called the Open Broad Agency Agreement. That is what I mentioned, the 3-pagers, where organizations or individuals, it can be anybody, private companies, sends us their idea. This has never been done before. We have a transformative idea and we can't find people to pay for it because it's too risky. It just seems not possible. That's sort of where we love to see that. And you can imagine we probably get a lot of proposals that may not be totally right for funding, but then you find that sort of diamond in the rough, and that's sort of how we want to think about it. Like, let me give an example. We just had a women's health sprint that was announced in collaboration with Jill Biden earlier this year. My part of it is called the Women's Health at Home piece of it. We got hundreds and hundreds and hundreds of really interesting proposals. We winnowed that down. We had a pitch competition live in Massachusetts, and we'll be announcing a small number that will then fund. But that's sort of the fun, and I'm incredibly proud of those, and they are transformative technologies in women's health that maybe we wouldn't have heard about any other way. But that's one of the ways in which we're sort of really being open to the community and the nation's innovative spirit.
Great. So to piggyback on that, what advice would you give potential grant applicants on ways to make their grant more competitive when you see it? Because I'm sure that you see a lot of applications, some better than others. Is there a common thread that you see in some applicants versus others that you would, if you can give advice to someone that may be interested?
The funny thing is, what was the thing, the famous quote that had been asked to one of the Supreme Court justices, how do you know pornography? And it's like, I know it when I see it. Yeah. I feel like that's sort of how at least we think about innovation. It's like, is it awesome? Is it cool? Is it something people haven't thought about? Like, if you internally ask that question, I'm just talking about for ARPA-H in particular, other organizations are going to be pretty different. I'd say start with that is the idea truly extraordinary? Have you refined it when you bring it to us in some way? That's the most important thing. The rest of it then is like, have you created a plan to actually achieve that? That's one of the things that we don't emphasize the process as much as we emphasize the kind of the brilliance and the excitement of the person who's coming to us.
And just to add to that, I think HRSA and our other sister agencies are really trying to attract new applicants. I think that historically we've seen that many organizations that are really well established, they're the ones that continue to be funding. funded. So we are trying to diversify who we're funding. HRSA is really trying to go out there and make sure that in a concerted effort, reaching organizations that may not be aware of all of the resources that are available. We have lots. Now, my particular office, I do not have any money to offer you, unfortunately. But our other bureaus and offices do. Health workforce, maternal health, behavioral health, primary care. And so we go out into the field and we'll do Grant 101 sessions, because grants.gov, I'm not sure if folks have perused that lately, but it can be a daunting process when you've never applied for federal funding before. So we are actively out in those communities trying to make sure that folks know how to access these funds. And in terms of advice, to give for a successful application, I think it starts kind of back with that partnership piece and collaborations and being intentional about partnering with others. Some of these larger organizations, there's lots of times an opportunity to create sub-awards to, brand new kind of that innovative, being able to kind of take risks in some of those innovative approaches and being able to, pilot ideas and things of that nature. So, but that is something that HRSA is really laser focused on, is diversifying who we're funding.
I just wanted to add very quickly, I would strongly encourage people to, and part of it, this is our responsibility, is to do a better job of making sure that people know of what resources and support is available. And we're actively working on this. This is a priority for all of us in the region, is take advantage of the resources that are available. So just like R.A. McCarthy was saying, HRSA provides workshops on pulling together proposals. SAMHSA, I believe, through a contract with Morehouse School of Medicine, they have a center that provides technical assistance and support for developing proposals. EPA, Environmental Protection Agency, they have what they call TIC-TACs, they're technical assistance centers. And not only do they provide support for looking for funding for environmental related issues, but across the board. And they reached out to us, they looking for opportunities to provide this type of support. One of the things that we hear consistently when we interact with these community level agencies is often they just don't have the capacity to go after these dollars. I spoke in Kentucky recently, and afterwards a gentleman came up to me. He was telling me how he has a community-based organization, and larger organizations will come to them and ask them to partner because they have the expertise, but they want them to volunteer or do it for free or have a minimal role. And so how do we try to get them to foster those stronger relationships and partnerships, but really how do we build the capacity of these community-based organizations if we really want to foster community engagement in terms of their enhancing their ability to access the resources that are already available.
And to add to that, take advantage to locality. We're all here, well, at least 3 of us are here, but we can get you in contact with Darshak. We have a regional office here in Atlanta, and our sole job is to engage with the community. The more people that reach out to us, the more we can get you connected and get you connected to larger collaborations of folks that are doing the work. So if you're looking for opportunities to partner with people when it comes to application, when it comes to being part of the larger ecosystem that are addressing some of these issues, reach out to our regional office because we have the perspective of who all is doing this work across the region. So please, find us. We will make sure that we connect with you if you're interested in collaborating, but that is what the regional offices are here for, is to connect with you all. So, last few minutes, are there any parting words or call to action that you would like to give the audience as we continue to move forward and extend our hand to collaborate with them? Anybody can start.
Sure. I don't know if this is parting words as much as this thought of, I just want to emphasize, we're in an amazingly great time in health for America. I know sometimes it may not always feel that way, but I just want to point out a couple things. The first is people may or may not be aware. Overall cost trends in Medicare are dramatically less than where we thought we would be about 10 years ago. We have saved an aggregate of $4 trillion compared to where we thought we would be if you look at congressional budget and other office estimates. It is an enormous amount that has been liberated. The question is, what do we do with that? Do we invest it in prevention, in actually improving access to care, and improving the health of all Americans in ways that are equitable? I just want to point out that those resources are there. We were incredibly successful, and the amazing thing is nobody knows exactly how we did it. So I think that means we can all take a little bit of credit for that as well. So I'd say that, and then what I put along with is that we're in an unprecedented area of innovation. It may not always feel that way to us when we're fighting with systems that need to be improved, but the innovation, the passion, and in fact the federal government funding and what we've been trying to do is really there to help people. And I truly, it's one of the reasons I came back to government after being in the private sector for 7 years. This is an amazing time with incredibly talented individuals that are trying to help. So I'll just leave with that note of optimism, which is how I truly feel I'm really proud to be part of the Department of Health and Human Services.
Thank you for that.
Well, first, I would just be absolutely remiss if I did not acknowledge our grantees and recipients and partners that, while HRSA is providing a framework and the funding, these are actually the folks that are doing the innovative work on the ground, integrating, addressing social determinants of health into their work. We have community health centers that are addressing housing issues. We have maternal health experts that are, thinking of new ways, telehealth, wearable devices that can monitor blood pressure and be able to kind of signal, when there may be an issue. So I just wanted to really kind of acknowledge our partners and grantees on the ground that are actually doing this really innovative work.
I know we're at time, so just quickly, continued collaboration. And one of the things so before I came to this position, I was 10 years at CDC, and one of the things that I consistently heard when I started to reach out to people is, especially during the height of the pandemic, was, I wish you feds would all get on the same page. Because people will hear from one and then the next, and we'll often be repeating the same thing or asking the same question. So better collaboration, coordination, and really one thing that we certainly learned is the importance of letting the community take the lead. And so the importance of community health workers, that was something that was mentioned earlier. And so how can we also further our strengths and ties with the community and learning from them as opposed to working from a prescriptive manner?
And I think that's a great note to end on. So if you don't mind, please give the panel a hand for their time. And thank you all.